When something doesn't feel quite right in your body, it's easy to brush it off or blame stress. But some symptoms shouldn't be ignored, especially when it comes to your brain. Today, we're talking about 9 critical warning signs of a brain tumor that you need to know about. Stay with us until the end because sign number 7 is often missed by doctors, yet it could be one of the earliest indicators something's wrong. First, let's understand what we're dealing with. A brain tumor is an abnormal growth of cells in your brain. They can be cancerous or non-cancerous, but both types can cause serious problems if not caught early. About 700,000 Americans are living with a brain tumor right now, and many didn't recognize the early warning signs. Now let's talk about the 9 critical warning signs. 1. Headaches that are different. Let's be clear, not every headache means you have a brain tumor. But certain types of headaches should catch your attention. These tumor-related headaches are different because they often start gradually and become more severe over time. They typically don't respond to over-the-counter pain medications like regular headaches do. What makes them really stand out is their pattern and intensity. When you wake up in the morning, the headache is often at its worst. This happens because lying down for several hours causes fluid to build up in your brain, increasing pressure. If you're getting headaches that wake you from a deep sleep, that's particularly concerning. These aren't like migraine headaches that might wake you up. These are different, more persistent, and often accompanied by other symptoms. What's really important to notice is how these headaches react when you move. If you bend down to tie your shoes, cough, or sneeze, the pain might suddenly get much worse. This is because these actions temporarily increase pressure in your brain. Regular headaches don't typically respond this way to movement. Another red flag is when your usual headache remedies stop working. If you've always relied on certain medications or techniques to relieve headaches, but they're no longer effective, this could be significant. The pain might feel more constant, deeper, or different in quality than your usual headaches. These headaches often get worse over time, both in frequency and severity. You might notice that what started as occasional morning headaches now happen several times a week, or even daily. The pain might last longer each time and feel more intense than previous headaches you've experienced. 2. Vision changes. Your eyes are directly connected to your brain, so they can be one of the first places to show signs of a brain tumor. These vision changes aren't like the typical need for reading glasses, they're more significant and often more sudden. When you experience blurry vision that comes and goes, it might happen at random times, regardless of what you're doing. This isn't like eye strain from looking at a computer too long. It can happen even when your eyes are well rested. The blurriness might affect one or both eyes, and it might be more noticeable at certain times of day. Double vision, or seeing 2 images instead of one, is particularly concerning when it's new. This isn't the slight doubling you might get when you're tired. This is persistent and can happen even when you're well rested. You might find yourself closing one eye to see clearly, or turning your head at an unusual angle to make the double vision go away. Some people experience what's called a visual field cut, where they lose vision in certain areas. You might not notice it at first. Maybe you keep bumping into things on one side, or you miss objects that are right in front of you. This can be particularly dangerous when driving or walking in crowded areas. Flashing lights in your vision, when they're not caused by external sources, can be another warning sign. These aren't like the occasional flash you might see when standing up too quickly. These can be more persistent and might appear as patterns or random flashes, even when your eyes are closed. Reading problems can be especially frustrating. You might find that text seems to move on the page, or that you can't focus on words like you used to. This isn't just about needing stronger glasses. The problems might be inconsistent, affecting you severely one day and less the next. 3. Unexplained nausea or vomiting. This symptom often confuses people because they naturally associate nausea with stomach problems. However, brain tumor-related nausea is distinctly different. It can occur suddenly, with no apparent trigger like food poisoning or stomach viruses. The most telling sign is morning nausea or vomiting that happens before you've eaten anything. This occurs because lying flat all night increases pressure in your brain. When you wake up and change position, the pressure shift can trigger intense nausea. Unlike morning sickness in pregnancy or acid reflux, this nausea might not improve once you're up and moving around. What's particularly concerning is when this nausea persists without any other digestive symptoms. You won't have diarrhea, stomach pain, or other signs that typically come with stomach bugs. Instead, the nausea might be accompanied by headaches or dizziness. Regular anti-nausea medications often provide little to no relief. The pattern is also important. This isn't a one-time occurrence. It might happen several times a week, or even daily. Some people find that certain head movements or positions make the nausea worse, which is a clear sign that the problem isn't in your stomach but related to pressure changes in your brain. 4. Balance and coordination problems. These changes often start so subtly that you might not notice them at first. You might find yourself grabbing for handrails more often when using stairs, or feeling slightly unsteady when walking on uneven surfaces. This isn't the normal unsteadiness you might feel when tired or after exercising. Writing changes can be particularly telling. You might notice your handwriting becoming messier or less controlled. This isn't just about rushing. Even when you take your time, letters might appear irregular or shaky. Some people find they start pressing harder with their pen or need to concentrate more on basic writing tasks. Dropping things becomes more frequent, and not just when you're distracted. You might fumble with buttons, struggle to pick up small objects, or have trouble judging distances when reaching for things. These coordination problems might affect one side of your body more than the other. The unsteadiness when walking can progress from subtle to more noticeable. You might drift to one side while walking, bump into door frames more often, or have trouble walking in a straight line. Some people describe feeling like they're on a boat, even when standing on solid ground. Daily tasks that used to be automatic become more challenging. Things like tying shoelaces, using utensils, or typing on a keyboard might require more concentration. You might find yourself needing to look at your hands while doing these tasks, when before you could do them without thinking. 5. Personality or behavior. Changes. These changes can be dramatic but subtle at the same time. Family members or close friends are often the first to notice because they see the contrast with your usual behavior. The changes might seem to come out of nowhere and aren't easily explained by stress or life events. Mood swings can be particularly striking. You might find yourself going from calm to angry, or from happy to tearful, with no clear trigger. These aren't just normal emotional ups and downs. They're more intense and often seem inappropriate for the situation. The aggression that sometimes appears isn't just being short-tempered. You might have outbursts that surprise even you, saying or doing things that are completely out of character. This might happen in situations that never bothered you before. New anxiety or depression can emerge without any obvious life triggers. This isn't the normal worry about daily problems. It might be a persistent sense of doom or sadness that doesn't match your circumstances. You might develop new fears or obsessions that seem irrational even to you. The loss of interest in favorite activities is more than just being tired of old hobbies. You might completely abandon things you've always loved, showing no emotion about activities that used to bring you joy. This apathy might extend to relationships and work as well. Decision-making changes can manifest in various ways. You might become unusually impulsive, making decisions without considering consequences, or alternatively, become paralyzed by simple choices that you used to make easily. Some people start showing poor judgment in financial matters or personal relationships. 6. Memory and thinking problems. These changes can be gradual but noticeable, often becoming more obvious over time. Family members might be the first to notice, as the shifts can be subtle yet persistent. They go beyond ordinary forgetfulness and can interfere with daily life. You might find yourself searching for words mid-sentence or struggling to recall familiar names more frequently. Forgetting appointments or misplacing items in odd locations could become more common. Tasks like basic math or balancing a checkbook, once second nature, may now feel confusing or frustrating. Losing your way in familiar places can feel disorienting, even when you've been there many times before. These aren't just senior moments, they tend to happen more often and with increasing severity. 7. Unexplained seizures. Seizures can be a critical warning sign, especially when they occur without any previous history. They don't always appear as the dramatic convulsions often depicted on screen. Some seizures can be subtle, such as small muscle twitches, brief moments of zoning out, or unusual sensations like tingling or strange tastes. Others might involve sudden, uncontrollable jerks or moments of confusion where you lose track of time. Even a single unexplained seizure, no matter how mild, is significant and should never be ignored, especially in adults with no prior history. 8. Hearing changes. Hearing issues can develop gradually and often go unnoticed at first. You might experience ringing in one ear, a constant buzzing sound, or hearing loss isolated to one side. Conversations may feel harder to follow, especially when there's background noise. These changes can go beyond hearing loss. Some people notice a sensitivity to certain sounds, making everyday noises feel overwhelming or even painful. Others experience balance problems linked to sound, feeling disoriented when noise shifts around them. Persistent hearing changes, even mild ones, can be early warning signs of a deeper issue. 9. Sleep pattern changes. Sleep disturbances can be an early signal of brain-related changes, especially when they appear without any obvious cause. You might find yourself unusually sleepy during the day, even after a full night's rest, or struggling with insomnia that feels unrelated to stress. Some people develop new snoring habits, episodes of sleep apnea, or wake frequently during the night for no clear reason. Waking up confused, disoriented, or feeling mentally foggy can also become more common. When sleep changes feel persistent and out of the ordinary, they may point to a more serious underlying condition. Now let's talk about risk factors you need to know. Some people are at higher risk for brain tumors. Age over 50, family history of brain tumors, exposure to certain chemicals, previous cancer history, certain genetic conditions. And what to do if you notice these signs. First, document everything. Keep a detailed record of when symptoms started, how often they occur, what makes them better or worse, any patterns you notice, how they affect your daily life. Secondly, see your doctor. Don't wait and watch. Early detection is crucial. Your doctor might do a neurological exam, order imaging tests, check your vision and hearing, test your balance and coordination, ask about your family history. You can get a second opinion. If you're worried and your doctor dismisses your concerns, it's okay to see another doctor, ask for a neurologist referral, seek a specialist's opinion, get additional testing, trust your instincts. Prevention and monitoring. While you can't prevent all brain tumors, you can have regular checkups, protect your head from injury, avoid exposure to harmful chemicals, know your family history, stay alert to changes in your body. Brain tumors can be scary, but modern medicine has made huge advances. Early detection and treatment can make a big difference in outcomes. If this video helped you understand brain tumor warning signs better, please give it a thumbs up and share it. You might help someone who needs this information. Has anyone in your life experienced these symptoms? Share your story in the comments below. Don't forget to subscribe and hit the notification bell to stay informed about important health information that could save lives. Remember, knowing these signs doesn't mean you should panic, but being informed helps you make better decisions about your health. Thank you for watching and stay healthy.